Assalamualaikum and very good afternoon. I wish to meet Ms. Siti, our teacher for the LPE program. My name is Muhammad Taufiq bin Muhammad KUSNI. My matric number is 207 and 199.
My name is Muhammad AZZAM bin Muhammad KAMIL. My matric number is...
Assalamualaikum. My name is Muhammad FARIS bin... My matric number is 207682.
My name is GUNAWAN ZAHRANDA and my matric number is 209554.
Right now, we are going to do group discussion portfolio for our LPE project 2301. Our theme is human right, and the focus is the banning of smoking in eateries is violating the right of people to smoke. The ban can be seen as a form of mistreatment on people's right on and freedom. What is our view? Okay, right now, in this topic, I am against the statement in public smoking because public smokers carry negative impact on health and environment and scenery. In fact, I think there are majority of people be uncomfortable around the smokers who smoke in public eateries. Guys, do you think that would be okay with this, the smoker in the public, if you are someone who at the next table to them? Are you okay being with the smokers or are you not okay?
Personally, I don't think it is okay to have someone smoking beside us, the next table us, especially when we are eating, because it really annoying to us. And to our topic, is it violating the human right? So in my view, it does not, because my first point is that there is United Nations National Human Right for Health. It states that the women and the children have their own right to have healthy lifestyle, to have a healthy and clean air to breathe. So as we know, smoking can cause the air quality around us bad. And for those who are passive smoker, the passive smoker is someone who are non-smoker but are exposed to the air. So they are especially more tend to develop cancer or have any respiratory ailment and many other negative impact for passive smoker compared to those who are smoking. So this is not about human right for the smoker. This is not about the smoker have their own freedom, but it is also about the other people around them that have the freedom, their freedom to have clean air. My next point is that there are no specific law that protect smoker about their right to smoking. But there are laws that protect other people to have healthy lifestyle. Just like I said before, that women and children need to have to be protected from bad air quality. That is my point of view. I pass to the next person.
Okay, so thank you, Azam. I think that your statement is correct, and there's also something that I would like to share, which is I think the banning of the smoking is suitable to be used for human rights, which is more to the non-smoker, because if people who are smokers, they are trying to say that the banning of smoking effect, it is not actually it is not actually good to say. There are fewer, there are lesser people who don't smoke while coming to public places such as the restaurant. And then for my first point, the banning of smoking in public places also can reduce the tendency of getting disease such as heart attack and lung cancer. Based on David Mayes, MPH Professor of Cardiology and Preventive Medicine from University of Kansas School of Medicine, he said that even breathing in low doses of cigarette smoke can increase one's risk of heart attack. This shows that people who are non-smoker, just like Azam said just now, they are going to it is going to be more dangerous than the people who is the primary smoker. Also, according to the projections by the authors, this nationwide banning of public smoking could prevent as many as 154,000 heart attacks each year. So by these foundings, we can see that there are much more evidence that shows that people who are second-hand smoker, their exposure is nearly as harmful to the heart as chronic as the primary smoker. That's all from me. Thank you.
Smoker still can smoke, but do not do it in a classroom because it is very harmful. Smoking can be in outdoor smoke because the smoke does not enter the classroom, and the smoke does not enter and circulate in the room, which can harm people who enter the room. That way, personal activity that are the right can be carried out without harming or depriving others of their right to enjoy a good and healthy environment, which is a human right.
From the previous speaker, we know that the smoker can give a negative impact for the people in the eatery. Earlier, I mentioned that smoking can give negative impact on the health, and this is because the passive smoker, known as someone who does not smoke indirectly for the smoke, but inhaling the smoke from the primary smoker is a situation where the released gas will enter the passive smoker unconsciously. From AZZAM opinion, it stated that United Nations have not given the right that smokers can freely smoke in the eatery because it, it gives negative impact on children and women, which they will inhale the bad air quality. And for the statement is support AZZAM statement, which is banning is suitable for non-smoker because non-smoker didn't carry out the smoke in their hand, but if they are smoker who enter the eatery and but they cannot see the smoke which are inside their body, it is harmful for the body which can cause heart attack and lung disease. ZAHRANDA said that smoker can smoke, but they must enter a closed room with a good ventilation. So she suggests that for the smokers, for the eatery, they must provide some space to the smoker to smoke freely. I see that there is strength and weakness in this issue, but I see that there is more strength is we to conclude that we are supporting the banning of smokers. Do you agree with this conclusion? That we support the banning of smoking in the eatery?
Yes.
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 Yes, I agree.
Okay. Our team has full work for support in smoking
Yes.
and banning the smoking in the eateries. So the conclusion, we support banning. We support the banning of smoking in eateries and violating the human rights because they cannot smoking in the public views is not reasonable. Because the strength is from this banning, we can reduce passive smoker, that we can reduce also the healthcare costs and lessen air pollution, improve productivity by the workers of the eateries, and decrease waste in the eateries. That's all from our discussion that I can see. Anyone want to add anything?
No.
No. End this meeting right now, and thank you for our participant today.